It's post-op day 1, you made it. This is gonna be a virtual appointment. Our MA is gonna reach out to you through our video conferencing system. They're gonna talk to you, they're gonna ask you how you're doing, they're gonna make a full body assessment, they're gonna go over your pain and your medications. After the appointment, you have to make sure that you take full body photos of all the different angles and send them to us through our HIPAA compliance system so that we can make a full assessment. Most of the appointments post-op day 1 will be virtual, with the exception of those patients that are receiving their massages with us here in the clinic. For those patients, I'll be able to see you in person. It's post-op day 1 and you've had your BBL. This is gonna be a rough day. The first 48 hours are rough. You're gonna feel like we beat you up for a couple hours. You're gonna be feeling maybe some lightheadedness. Sometimes the heart rate can come up. All these things are expected. Over the course of the first night, you probably had a lot of drainage, fluid coming from all the little incisions, and this is also quite normal, even if that fluid looks a little bit red. So don't be alarmed. Of course, we're always here for you 24/7, so if you need anything, just make sure you call our emergency number. On post-op day 1, we're gonna have your virtual appointment. We are gonna look at the entire body, so be prepared for that. And once the appointment is done, we're gonna ask you to submit photos of the front, sides, and back so that we can make a proper evaluation and give any potential further recommendations. Make sure that you are hydrated. You have to drink a gallon of fluid a day, mostly water, but some Gatorade, some pineapple juice as well. Post-op day 1 is when you're gonna have your first massage, so you can go ahead and remove the faja at that point in time. It's probably a good time to think about washing the faja because it's probably soiled with all the drainage from the night before. Once you're done with the massage, you're gonna have your first shower. Make sure that the first shower is not too hot, otherwise you may feel lightheaded. So you want the water temperature to be room temperature or perhaps even a little cold. After your first massage is when you're gonna be able to place the foams within your garments. And just know that when you come on post-op day 5, we'll also give you further instructions as to how to place those foams. It is very important that you're doing your walking. Remember, we want to decrease the risk of blood clots. So you have to walk at least 10 minutes every hour while awake. At night, you can get a little stretch of sleep, but it's 5 hours max. After 5 hours, you need to get up and start doing that walking routine once again. For out-of-town patients who have flights over 3 hours, it is mandatory that you receive the VenaPro device. This is a device that goes around the legs and it keeps the circulation moving and it decreases the risk of blood clots. We're gonna give you that device on your pre-op day. You can start using it right after surgery and it's gonna be your new best friend for the next 2 weeks. You're gonna use it at night while you're sleeping or just whenever you're not being very active, for example, if you're watching a movie, and certainly for your flight home. The only times you're not using this device is when you're in the shower, of course, or when you're actively walking and moving around. If you do have the VenaPro device, then you can sleep a little bit longer, up to 8 hours. So for our patients that are in town or have shorter flights, if you want to get a little bit more rest, then I highly recommend the VenaPro device as well. Post-op day 1 can be very tough. I mean, surgery is not easy. All right, but please remember, all of our staff and myself, we're here with you every step of the way.